Hello and welcome. Today I'll be talking about polycystic ovary syndrome as a cause of infertility. Quite a number of couples suffer from issues of having children, and it can be a very, very difficult situation for them. And so if you know somebody, you know couples that are going through so much in their marriage because of trying to have children, this could be one video you'll be desirous of sending to them, as we're going to be discussing how to diagnose this condition and what role you can play in treating this condition. I'm talking about the sufferer or the person having this condition. Now, a major aspect of this discussion will have to be with obesity or excess weight. I've done another video on obstructive sleep apnea with respect to obesity, and I encourage you to also watch that video. Now we're going to discuss this condition, how to diagnose polycystic ovary syndrome. Now there are three conditions I'm going to mention here, and if a patient has two of these conditions, the patient is said to have PCOS. That's a short form for polycystic ovary syndrome, PCOS, or PCOS. Number one, if you have anovulatory cycles, in other words, you have irregular periods, is either you don't ovulate or you ovulate infrequently, that could be a pointer. Now, I'll say that this usually will be very clear from your history. When the doctor is speaking to you, you'll be able to tell very clearly whether you have a history of irregular periods. Number two, excess androgens. A female has more of estrogens while a male has more of testosterone. When a female now begins to have a lot more testosterone than she should have, then she would have certain features that will be pointers to a high level of androgens. Number one, the patient could have hirsutism. In other words, when you see a female developing excessive growth of hair in areas such as the face, the chest, the back, that's an indication that this patient may have a raised level of testosterone. What a doctor does is to do a blood test that would indicate raised level of testosterone. So number one, we said irregular periods. Number two, we said excess amount of androgens or testosterone. Number three, polycystic ovaries. The ovaries are the glands where eggs are produced and stored. When an ultrasound scan is done, it will show that the ovaries are enlarged because you have a situation where there are fluid-filled sacs around the eggs. So enlarged ovaries or polycystic ovaries. Number two, excess testosterone. Number three, irregular periods. If a patient has 2 out of 3 of these, the patient is said to have polycystic ovary syndrome. What are the manifestations of this condition? Number one, weight gain. And this is really very important. Now, some of us are in societies where if you become too thin, people start asking you questions and are wondering whether you're either not eating well or you're sick. The problem is that being too fat or being obese or being overweight comes with its own problems. I've said earlier on that I've done a video concerning obstructive sleep apnea. I encourage you. I'll put the description of the link. I'll put the link in this description so you can also watch that video. Another problem that is associated with infertility is obesity. And so in these patients with polycystic ovarian syndrome, they do have excessive weight. Now, how do you tell whether your weight is excessive or not? You can easily calculate your body mass index. This is the body mass index, or BMI, is a relationship between your height and your weight. And so what you do is that you weigh yourself and measure in kg or kilograms, and then check your height in meters, your weight over your height squared. In other words, assuming you weigh 100 kg, so you say 100 divided by, say you weigh, you measure 6 meters. So 100 divided by 6 times 6. When you get that value, if it is greater than 24.9, you fall into the category of either being overweight or obese. Above 24.9, overweight or obese. By the time you are talking about greater than 30, then that's really where obesity starts. So above 24.9, you are overweight. And so that's a very good way to at least tell whether you need to lose weight. Number 2, skin manifestations. Acne. This is a situation where you have the hair follicles being plugged by oil or dead skin cells. One of the ways to easily remember this is pimples. Number 2, under skin manifestations will be skin tags. Now, these skin tags are usually small growth. They're harmless. You don't really need to do anything about them, but they are indicative of excess weight or manifestations of this condition. Under skin manifestations is a condition called acanthosis nigricans, where the skin becomes velvety, darkened, and thickened. Usually you'll find this around the neck or in the armpits or axilla. We call armpit axilla in medicine. Another manifestation is that these patients have a tendency or an increased propensity towards developing type 2 diabetes mellitus. Diabetes mellitus is a condition where the body is either unable or produces less than required amount of insulin from the pancreas. Number 4, they have also a tendency towards raised cholesterol level. And then number 5, which is the focus of this video, infertility. Now, the patients that have PCOS, because of their irregular periods, now let's just step back a little bit. For you to be able to get pregnant as a female, you have to have regular periods, in which case you have to have ovulation where the ovaries release eggs. Because of this condition of PCOS, the ovaries are not releasing eggs or releasing eggs infrequently, and so the chances of becoming pregnant become significantly reduced. And that is the reason why patients that have PCOS are sometimes suffering from infertility. The cause of this condition is unknown, but is associated with high levels of insulin. I've said that insulin is produced by the pancreas. What insulin does is that it enables the glucose or the sugar in your system to get into the cells where it is required. For some reasons, the patients that have PCOS have insulin resistance. Because of the insulin resistance, the body assumes that there is not enough insulin and so produces more insulin than should be. Now, if you're trying to open a door that you have a key to, you've done the motion, you expect that the key should be open. What happens then is that when you try to open the door and it's still not opening, you apply more force. Exactly what the body does. The body feels that it's releasing insulin, but the insulin is not doing the job because there's some resistance, and so it increases the amount of insulin. By so doing, the problem is that this patient now suffers from hyperinsulinemia, which simply means an increase on excessive amount of insulin. The problem with that is that when there is excess amount of insulin, the insulin causes the body to produce more testosterone. Remember, I said that testosterone is the hormone that is present in a male. This excess amount of testosterone interferes with the development of the follicles, that's the sacs in the ovaries where eggs develop. And so, at the end of the day, it prevents normal ovulation. And once you don't have regular ovulation, there is hardly any chance you're going to get pregnant. Number 2, the raised insulin level is also the reason why people become overweight. Overweight in this instance means, calculation from BMI, I said if you're greater than 24.9 and above, you are overweight, and as it gets further, you fall into the category of obesity. So, insulin is an anabolic hormone. It builds up, and so because of that, patients, number 1, have problems with ovulation, number 2, increase their weight. Now, what can be done about this condition? How do we manage this condition? The first thing is to recognize. Remember, I said that the diagnosis is made from your history, which is irregular periods. Number 2, from the blood test which the doctor will do to show that there's a raised level of testosterone. Number 3, an ultrasound could show that there is polycystic ovaries. If you have 2 out of these 3, then you fit the category of the diagnosis for PCOS. The specialist that you will need to see will be a gynecologist. That's a doctor that is specifically trained to handle this condition. Another doctor that you may need to see will be an endocrinologist, because this is a hormonal issue, and so an endocrinologist may need to also be a part of the treatment. And then a dermatologist in case of skin manifestations. So what can you do? What role can you play? I said at the beginning of this video that we're going to learn how to diagnose and what role you could play. The role you could play is to lose weight. It may sound very simple, but this is one of the ways to manage this condition. Losing weight will significantly help. First step, check your BMI and aim to get to the point where your body mass index is less than or below 24.9. Of course, do not lose the weight to the point where you also become too thin. That may also have its own problems. So it's important to mention that we don't want you to be too fat. We don't also want you to be too thin. Number 2, cosmetic treatment for hirsutism. Of course, it can be very embarrassing, very psychologically disturbing for a lady when she begins to have hairs in the face or areas that she's not supposed to have as a female. There are treatment modalities that can be deployed, from laser therapy to medications, to address that. And then the doctor, the gynecologist, can also prescribe medications for your irregular periods to help you have regular ovulation. And then if these do not give the desired result, there's also the possibility of doing some form of laparoscopic surgery to remove tissues surrounding or producing the androgens. Remember, the androgens produce the testosterone, or testosterone is a form of androgen. So if you can take off those tissues, that will invariably help to address the problem. Now, if your question is, can I become pregnant after all this treatment? The answer is an emphatic yes. And so if you've listened to this and you've learned something from this video, my encouragement today to you is share, like, and do subscribe. There are a number of other videos that I encourage you to listen to, and see you next time.